Now to the dangers and risks of stroke, affecting millions of Americans every year. So what do we need to know, especially for guys who we know sometimes tend to ignore symptoms? Dr. Patrick Matoole is a neurologist with Franciscan Health and is here to help us out. Thank you very much for being here.
Thank you for inviting me.
So first of all, we've all heard of the term stroke, of course, but how do you describe what a stroke is?
A stroke is a pattern of historical and physical examination findings that suggest vascular injury to the brain.
And why is it important to act fast?
Because the sooner we diagnose a stroke, the sooner we can treat a stroke, and time lost is brain lost. The sooner we can help a patient to recover by having them present early, you can delay or you can decrease disability and get them back to their quality of life.
What are the signs and symptoms that we should be looking for and aware of?
The signs of a stroke depend on the mechanism of a stroke. There are basically two ways you can have a stroke. You can deprive an area of brain of blood, or you can bleed into it or around it. If you deprive an area of the brain of blood, you can have difficulty speaking, difficulty articulating speech. You can become weak or numb on one side of the body. You can have difficulty seeing to one side or the other. If you bleed into an area of the brain or around an area of the brain, patients tend to develop a really bad headache. They tend to be less alert, more sleepy. They're often nauseated and vomit. And then, in addition, you have the other symptoms with the speech, movement, sensation, and vision.
And so as soon as you pick up on something like that, what do you need to do?
The sooner you can call 911 and get to the hospital, the better.
Okay. Are there any factors, any additional stroke factors for men?
On a case-by-case basis, really no.
Okay.
You can get stroke-like symptoms if you have metastatic prostate cancer, okay, which is usually seen in older individuals or older men, but on a case-by-case basis, no.
Let's say you're experiencing symptoms, you call 911, you get to the hospital. How is that treated? What happens once you arrive at the hospital and you get treatment?
You're examined by a physician. You usually get a CAT scan to make sure that you haven't had a bleed. You usually have a blood vessel x-ray, which is called a CT angiogram, which is designed to identify a potential clot, which might have caused the stroke. And then the treatment depends on how quickly you get to the hospital after the onset of your symptoms. If you present within about 4.5 hours of the onset of your symptoms, you can get a medicine called tenecteplase, or TNK, which is designed to dissolve the clot, okay? In addition, all the way up to about 24 hours after the onset of your stroke symptoms, if you have an identifiable clot, an identifiable lack of blood flow beyond where the clot is, a type of neurosurgeon can insert a catheter into that blood vessel and actually remove the clot.
And so what is recovery like?
Again, it depends on how quickly you intervene, okay? We used to say about 2 years after a stroke, you tend to get maximum improvement. We now know that you can recover from a stroke for the rest of your life.
All right. Any parting words or anything else you think we should know?
There's an acronym in neurology, be fast, okay? Each individual letter is a symptom of a stroke. B is for balance, if you have trouble walking. E is for your eyes, you have difficulty seeing to one side or the other. F is for your face, if it starts to droop on one side or the other. A is for arm, which means if your arm or leg get weak on one side or the other. S is for speech. You start to have difficulty talking or articulating your speech. And T is for time, okay? The sooner you can get treated, the better.
All right, Dr. Patrick Matoole with Franciscan Health, thank you so much for being here.
Been a pleasure, thank you.